I am joined at the end of our first afternoon for the 2025 CHNC Symposium by Jackie Evans, Theresa Grover, Karna Murthy, strongholds in the CHNC network, history, legacy. And you guys are going to give us the CHNC updates since we last spoke last year about this time.
Right. Well, we are thrilled to be back for our annual symposium, and I think I'm most excited about the growth of, the organization as a whole, but also the symposium. I think
Absolutely.
we have, over 550 attendees this year, and the symposium itself continues to grow every year, which is really exciting for us to see the energy and the excitement of everyone who's participating.
And I heard you've grown to 52 centers.
That's right.
Wow. What is the goal? Everybody.
Well, I think, we really thought we were going to cap out at 40. So there's 100 some plus children's hospitals in North America. So any you're welcome to join.
I love that. I love that. And actually, I think that's a great segue. So what should people do if they're interested in joining the CHNC?
Oh gosh, I think, we're excited to talk to any of the hospitals that are finding our mission and our services of value. They can reach out to CHNC through our website or to Theresa Grover or myself, and we're happy to give them introductions about what to do and what benefits CHNC can provide for their organization.
I love that.
Yeah.
I love that. We've been asking everybody a little bit about what they were looking forward to this year. I know as soon as we're done, you guys are looking forward to the next iteration. Tell me about some of the special things for this 2025 edition.
For CHNC in general,
I think. And the symposium this year that you were looking forward to.
I think for me, for the symposium, we're very excited about our 4 keynote speakers. We, I think, have a really interesting just kind of variety of topics that they're covering. We also have a panel discussion tomorrow as one of the keynote speakers, which is related to maternal mental health. So that's something that we're excited about. I'm personally most excited, I think, about all the workshops. I have a number of workshops each day. And I think those are great because they have really offered an opportunity for either the focus groups or individual groups to come together and share in a much more detailed, fashion the work that they're doing, but also to kind of share what they're learning and get input from the other participants in that. So we have some really great workshops coming up in the next couple of days. And I think it's just such a nice, fun environment for people to learn from each other and have actual meaningful, conversations. So talk to that.
I think for me, it's to see this has really become a community that we never really anticipated. From way back when, it started with such a small group of 10 or so folks just investing in the idea. But now to see folks from 52 and more hospitals arrive, talk to each other about their own internal clinical care, academic collaborations, quality improvement, their patient care services that they offer at their institution, you can really see that collaboration that I think is bigger and better than ever. And I think a close second for me is, the data that we have amassed over all these years is starting to really sing for different projects and different topics and different, both the risk calculators that we are probably going to discuss, but also to see just these really rare diseases have science put behind it that we've never been able to see before is really fantastic to watch. So we're I think all pretty excited.
I can tell you, even in the CHNC is now more than 2 decades old, right? You're in your 20...
2 decades.
Yeah, 20 years old. Even in the last 3 years that we've been coming to the conference, we've seen the exponential growth, ourselves. And I think that's really so excited. It's really you build it and they will come kind of phenomenon, though I know a lot of hard work has gone into the CHNC. And Jackie, I recognize this is a very special symposium for you this year. What were you looking forward to?
Well, I think it's always one of the fantastic things is networking. We actually, when we started, we didn't really have big plans to have an annual meeting, but it's become sort of the highlight the point of the whole organization, I think, each year. And you can just tell by the background energy.
Yes.
Yeah, that's what's happening. But for me, I retired this year
Congratulations.
from the operational side of the organization, continuing on with the board. But it's been kind of an intense 20 years, to be honest.
That's right.
So it's kind of nice to step towards the other side of things and then just see all this.
Yeah, that's lovely. And now you've been a part of the CHNC basically from its inception. What was that like to, have your career also follow the kind of trajectory of an organization that has grown like this?
Well, yeah, that's interesting. I mean, it sort of all started because there were these groups of clinicians, nurses that were working in children's hospitals and just having different challenges than the many other NICUs. A lot of the same challenges, but some unique challenges of units that get babies from far and wide, often with the uncommon and rare disease, and that was sort of the initial idea of it. And I think we're just really happy of where it's all gone and which is much more than what we had expected.
I love that.
That's a big understatement. I think you never imagined it would turn into this
Yeah.
at all. Yeah.
Because we kind of thought of, we'll have this little database and it'll help
Little
improve
database.
the knowledge. And then all of a sudden, really our membership wanted to do this, wanted to do that, wanted to, have a meeting, wanted to have meetings. And our leadership didn't know how to say no. And it just kind of ended
still
up with
don't.
this. Yeah.
That's where the QI program, I think, really hit. We were just thinking about it, getting some data and trying to understand these kids. But even early on, the QI leaders, Dr. Brzezinski from St. Louis and Jean Pilato from now Charlotte, Anthony Piazza from Emory, they started this idea even before we had a lick of data to try to improve something that we weren't very good at. And I think that really bought in a lot of traction for getting people involved even before the data was ready to mine or sing. So I actually think that was one of our key pivotal steps. And that was probably 2-3 years after we got going. I think that helped people get engaged and stay that way.
Makes sense. And now I understand that registry has grown to 375,000 babies and growing, it sounds like. That's incredible. Such a huge amount of data that that you all have access to. I think that's absolutely incredible.
And that the focus is on these children that have diseases that are just really difficult to understand in any other situation besides pulling together 50 some odd centers over many years.
Yeah, because no one institution would have enough numbers for.
Yeah, and I can honestly say I think we feel confident to say that maybe no other registry has this type of access to clinical information. So we're just excited to have our fingers on that pulse, and it's all really the credit of these amazing data coordinators around the country, the institutions that support them, to allow this to continue to grow.
Love that. What were some of the milestones for the CHNC this year? Accomplishments.
I think, as you said, we've grown quite a bit. We've added 3 new centers this year, and we're now at 52 centers. So I think that growth is exciting. We're just getting ready to finish our now 6th large multi-center QI collaborative, and are designing the next project that will roll out next year.
That's right.
And those have been wildly successful, and people have been very excited about participating in those as well. I think we've also grown with the activities and the engagement of the group, and we're quite excited about that. I think we continue to add focus groups. We've added 2 new focus groups this year, and I think given a lot of opportunities for folks to develop their careers. And there are a number of people who have really focused much of their career development on the activities within our research focus groups and using the data, and that's something that we're really quite happy that we've been able to provide that opportunity and place for people to thrive academically as well.
One thing I've been excited about is over the last 2 or 3 years, we've really given these groups the opportunity to ask their own questions of our data. And I think in many other registries, that's pretty hard to do. But I think thanks to efforts of our staff, Theresa and others, there's now a mechanism if you have your question to ask it. And what, Theresa, didn't you say we've done like 28 to 30 publications in the last 18 months?
Wow.
So people are really taking
Total 125, right?
Right.
Yeah.
25 total, and that's just since 2015. And
Right.
and so it's been a great decade, but allowing people to use their data to help their own clinical practice, their own research or QI question, we think that's pretty novel to be able to do, and we're excited to support the people in the hospitals in the consortium to help their curiosity, really. Yeah.
I love that. What does the future of the CHNC look like? What are the goals in the next handful of years?
Gosh, I mean, making babies better.
That's right. That's right.
That's always been the one. But I think, our goals are to grow as we can where it makes sense. Again, we want to have hospitals that get value from what we offer. We, I think, have other goals to continue the research and QI enterprises to be on a successful trajectory. And I think from an organization perspective, to continue to expand the expertise of our leadership groups, maybe even think about some long-term, not short-term, but long-term succession planning would be exciting for us to understand that this organization is going to outlive our careers for sure.
But what a legacy. Yeah.
We hope so, from your lips to, we'll see what happens, but I think so. And I don't know, I think we have a lot of database modifications, including how we extract and collect the best data for the best outcomes is probably a big, not only what we do, but how we do it is probably the next big lift for our organization going forward. Yeah.
Other hopes and goals?
I would just tag on to, I think, keeping the data that we're collecting in the data registry relevant is really important, and we're looking at the best way to do that. We look back now when we first designed the initial data registry. That was now 16 years ago, and we know that clinical practice has changed during that time. So we're constantly relying on also the members of CHNC to help us understand, when we need to add new fields or retire things that are now obsolete, and making sure that the data we're collecting is the right data. So that's an ongoing, continual project, I think, for us too.
But we're excited about the possibilities of being able to get more data without it being, too onerous to actually achieve, because we've never had massive amounts of lab data and, different, test data and so on. And with what's going on with the rest of the medical world, some of that's going to be possible to even give us deeper knowledge.
Yeah, that's very exciting.
Soon-
Rooting those people.
Soon we'll jump on the AI train.
Yeah.
But we have to, support the AI train well.
That's right.
Yeah.
That's right. And make sure the data is as clean as possible, the way you guys have always done it. I think that's remarkable. I know we're getting to the end of our time here together. You guys have talks to get back to. I know there have been some opportunities to honor Jackie's work and legacy, but we'd love for you if you want to share some things with her on the air, recorded.
I've already done I've already done too much, really.
No, I mean,
I planned to retire, 15 years ago. So,
Well, we're lucky you stuck around with us.
yeah. No, I mean, I think just it's hard to put into words,
Yeah.
honestly. I think the vision and the implementation of that vision, that Jackie has done over many, many years, and I think has done things that I don't know that any other human could have accomplished, and at this scale, we're forever indebted for that. But I think we all have our stories that
I'm sure.
of how she's kept us all on track and encouraged us to do more than we ever imagined we could do.
and I think from my point of view, surround yourself with amazing people and amazing things happen.
I love
Yeah.
that. Yeah.
Yeah, we have too many stories, most of which we probably can't share.
That's
But
I think that's when you know that you've really gotten to know each other well, right? When
yeah, but beyond the consortium, I think she's been a mentor to so many people, not
Yeah.
just me, but so many people in their careers. It's just look around at the 580 people here. The room would be empty without Dr. Evans's efforts, and so I think we're all grateful and hope we can live up to 30% of that legacy over the next few decades, and we'll still be amazingly successful.
I love that. And I'll ask as your closing thoughts, what is something you want the community to know about the CHNC?
I mean, I think I mean, this group, I think, is just unbelievably inspired by our predecessors. We hope that we can do the same for the people who are interested in joining and getting involved. It's a challenge to keep doing that, but that challenge benefits our patients, our families, our hospitals. And I guess my request of the people listening is, if you want to get involved, our doors are open, and please seek us out, because we are sure that there's an opportunity for anybody's interests who are interested in neonatal medicine.
I think one of the things we've done for a long time is encourage people from sites that are interested to come to this meeting, because it's kind of here that you can really get an idea of what's going on, what the people are like, and how the organization sort of built from the bottom up. And you can do anything in this organization if if you want to.
Theresa, Jackie, Karna, thank you so much for the work that you continue to do, for putting on this amazing symposium, for having us here to be a little part of it and share some of the work. We've already learned a lot today, lots of pearls for the community, and we're looking forward to hearing more. So thank you.
Thanks,
you.
Daphne.
We're
We love to
excited.
have you here.
Yeah, I'd love to have you. See you next year, we hope.
Yeah, thanks for the
Good.
opportunity.
Thanks.
Okay.